Hello, I am going to continue my talk about the visual field interpretation. I'm talking about the Humphrey visual field. I'm going to continue the single field analysis. Today, my talk will be about the total deviation plot map and pattern deviation plot map and the gaze tracker chart. Here, I'm starting with the total deviation plot map. The total deviation plot map is the deviation of the patient's result from the age-matched control at each test location, whereas the pattern deviation plot map is similar to the total deviation plot map, except it is adjusted for any generalized depression in the visual field, such as that caused by the cataract or by the meiosis. Before going deep in the total deviation plot map and pattern deviation plot map, I'm going to explain what is the probability. The probability is a measure of a chance of getting some outcome of interest for some event. In simple words, it is the chance that something will happen. Now the total deviation plot map, you can see here how the map presents. We can see the dots and their different kind of scotoma. 4 dots where the p-value less than 5% and a lighter shaded box where the p-value is less than 2%. The moderate darked box where the p-value is less than 1% and the fully darked box where the p-value less than 0.5%. While reading the total deviation map, we are looking at the size and shape and location of any abnormal points or boxes. The generalized depression in this map, like in cases of cataract or meiosis, the darkly shaded boxes will uniformly filling the grid, and the localized defect may be hidden by the generalized depression caused by cataract or corneal cloudedness, so it is difficult to get the localized defect while reading the total deviation map. So to detect the localized defect, it's better to go to the pattern deviation plot map. This is the pattern deviation map. Also, it's similar. There are dots, which are the normal values, and the 4 dots, scotoma and lighter shaded box and moderate darkly shaded box and the fully darkly box where the p-value is less than 0.5%. So it's very important to carefully inspect this map for early detection or progression of the glaucoma visual field defect. And for each test location, as we can see, is graded as normal. Normal is the dots, and abnormal as defined level p-value compared to normative population. Abnormal 4 dots where the p-value is less than 5%, and the lighter shaded box where the p-value is less than 2%, and moderate darkly shaded box where the p-value is less than 1%, and the fully darked box where the p-value is less than 0.5%. The lower p-value, the greater its clinical significance and the lesser likelihood that the defect having occurred by the chance. For example, here we can see the probability, the p-value at this location is less than 1%. What that means? That means at this point, it's abnormal, but it can be normal in less than 1%. So the chance for this location to be normal is less than 1%, and so on for the other defects. Now going to explain the gaze tracker chart. As I said before, this is the gaze tracker chart, which you can find it at the bottom of the printout. Here, as I said, it can be used as a new device of the reliability of the visual field through the prediction of overestimation or underestimation of the result of the visual field. The gaze tracker system will monitor the gaze position at each stimulus presentation, frequency of eye movement per stimulus, the frequency of eye movement per stimulus. We can see here the upward bar and downward bar. The upward bar in the chart indicates to the fixation disparity, and the length of the upward bar represents the magnitude of the disparity from 1 degree to maximum 10 degrees, where the short downward bar represents the tracking failure frequency, and the long downward bar indicates eye closure, blinking frequency, or tear film breakup due to dry eyes during the test. To understand it more, we can see this magnification of the gaze tracker chart. We can see the 2-degree eccentricity, where the frequency of the eye movement between 1 degree and 2 degree, and there are 5-degree eccentricity, where the frequency of the eye movement between 3 degrees and 5 degrees, and the long one is 6-degree eccentricity, where the movement or frequency of eye movement per stimulus 6 degrees or more. So the long one is 6 degree, the moderate 5 degree, the less height of the upward bar is 2 degree. Going to downward bar, the smaller one is the tracking failure frequency, and the long one is the blinking frequency. It's found that high values of the movement between 3 degrees, 5 degrees, and 6 degrees or more, along with the tracking failure frequency and blinking failure frequency, all of them tend to lower the mean deviation value. Thank you for listening.